Before we begin our official program this morning, I wanted to welcome you for something that you didn't know you would be witnessing this morning. But there are always bonuses associated with eHealth Week, and this is one of them. I'm Jeremy Von Feeney. I'm the International Vice President for HIMSS, and healthcare transformation is an international initiative. We're currently in Latin America, in Chile, Brazil, Costa Rica. We're in Asia Pacific, in Singapore, and in Thailand. And for today, we're going to talk about the Middle East briefly. HIMSS has been transforming healthcare with partners like the Dubai Health Authority in the Middle East, in Saudi Arabia, Qatar, and the United Arab Emirates. So we're here to recognize an international delegate, Dr. Osama Al-Hassan, who's joined us to execute an MOU to launch an eHealth Week in the United Arab Emirates. The UAE is embarking on a very ambitious program to transform healthcare there through a health information exchange, a national health information exchange that will be fed by several regional HIEs. There's also a major EMR implementation underway in Dubai, and Dr. Osama and his colleagues at Dubai Health Authority have been monitoring their progress through the HIMSS Analytics EMR adoption model over the past few years. So with this, we just wanted to have a signing ceremony to recognize Dr. Osama coming from Dubai to join us here today to see the European eHealth Week and to bring what good ideas that they'll witness today from the eHealth Week in Amsterdam to the UAE eHealth Week in October. So thank you, Dr. Osama, for coming. We're going to execute our memorandum of understanding, and we appreciate your support and look forward to seeing you in Dubai in October. Thank you all. Our program will begin in approximately 5 minutes. Have an excellent remainder of your eHealth Week, and thank you so much for your attendance and participation. So thanks once again.
Oh, thank you. Good to see everyone this morning. We don't have drums opening the session, but that's okay because you all look wonderful and energized. We covered a lot of ground yesterday, didn't we? I know that everyone would have been busy in all of your different sessions, and we had some fantastic speakers. I thought it was worth just maybe going over some of the points that we touched on, some of the things that came out of the general dialogue that we had. Of course, we heard from the Commissioner. He spoke about deploying existing social networks. He spoke about building networks that cut across different areas of life that include families, medical practitioners, and society. We heard from the Minister, Edith Schippers. She spoke about how even though there are disparities in healthcare systems within Europe that will impact the application of e-health, in the region, there are still technologies that we all have access to. We all have a mobile phone, so in many ways, even though divides are in place, technology can help narrow that divide. We got a sense of the challenges still facing e-health adoption, barriers around funding, scaling up, and of course winning hearts and minds, including those of the people that are actually going to be part of the delivery system, reticence on the part of healthcare practitioners in some cases. And then in the afternoon, we really kind of drilled down, and thanks to Omyek Vroom, got a fantastic insight on the importance of the individual, and I deliberately use that word instead of saying patient. In many ways, the answers are right in front of us if we consult the right people when it comes to designing and developing those solutions. And finally, your own task rounded the day off nicely by really driving home the point that we already have the technology and the tools to meet people's changing behavior and expectations. In many ways, it is about how we use and leverage what we already have. So yes, the challenges are there, but the system is already being disrupted. Change is happening. How do we get it to happen faster? So today we'll continue to look at how we should be dealing or tackling those challenges. And we're going to really hone in on the issue of trust and standards, which of course is crucial to the progress of e-health. So let's start by getting a taste of that now.
Ik heb zelf het gevoel dat wij niet zo bang moeten zijn voor die data die in de cloud is. Laten we veel meer gebruik maken van big data, small data. Laten we ons ook realiseren dat de jongere generatie daar veel makkelijker mee omgaat. En ik vind dat wij echt af en toe te krampachtig doen met privacy. Natuurlijk moeten er een paar goede regels zijn, maar voor de rest, er liggen nog zoveel kansen die ons als mens en als maatschappij kunnen helpen door beter gebruik te maken van alle data die beschikbaar zijn.
Embracing the technology always begins with sharing stories and always begins with taking the time to discuss the risks, taking the time to discuss the anxieties.
Ik denk dat je gewoon moet zeggen dat niks online veilig is. Dat we gewoon in een onveilige samenleving verkeren op het gebied van data. Dat je daar gewoon eerlijk over moet zijn. Maar dat je wel maximaal eraan kunt doen om het zo veilig mogelijk te maken.
There's two elements to why it would be a risk. The first element is shame around your health data and what do you have to hide. And the second element is the risk to your financial status and whether or not you would get reimbursed or supported by systems.
People can manipulate these data, and this may have huge effect on lots of people. Or people can steal data, or people can make the data unreachable. But on the other hand, people are not afraid at all to share their data on Facebook, which in fact I find much more unsafe. I think the most important aspect is the value of the data also for future generations, because my data, and together with all data of a population, we can analyze these data and we can really improve people's life in the future.
Everyone's data is worth a lot of money. That is the downside of such a data explosion. But the upside is that I can be informed about my personal condition by being able to own my own data and to see my own data and to discuss that same data with professionals around me.
Kijk, als je op een gegeven moment mensen zelf de verantwoordelijkheid geeft over hun eigen data, inherent aan allerlei andere ontwikkelingen, dan gaan mensen zich ook veel meer eigenaar voelen van hun eigen gezondheid. Daar ben ik van overtuigd, dat mensen dan niet meer denken van, joh, dat is iets van een instelling of van een ziekenhuis of wat dan ook. Nee, dat is iets van mij. En ik autoriseer mensen dus, mensen die moeten dus vragen om van, goh, mag ik in dat dossier van jou samen met jou aan het werk gaan?
But as an individual, I want to know from the corporation, what is your intent with my data? And if your intent is to help improve the system and help improve access to medication, no problem. But if the intent is to earn a profit off my data, then let's have another conversation.
Okay, so I think that gave you a bit of a taste as to the focus of our presentations and our discussions. So the plan now is that we will hear from a few of our speakers and then we'll get together for a bit of a chat afterwards. It would be really good to get your thoughts and questions because, you know, this is something that I suppose is key to the sort of progress of eHealth, to the uptake of these digital solutions. So, you know, get your thoughts and questions to us. You can do that on Twitter using the hashtag eHealth. I'll be on Twitter looking at that. Or you could also tweet me any thoughts or questions you might have at Mariam Namazi, and then I can put your thoughts and questions to our speakers a little bit later on because you know, we've got some fantastic presentations coming up. So let's start by hearing from the Secretary General for the Dutch Ministry of Health, Welfare and Sport, Erik Garretson.
Good morning, everyone. How's everybody doing? You're looking forward to the second day? Had a nice day yesterday? Yes. Okay. Well, ladies and gentlemen, let me first start by congratulating you. Yesterday, the eHealth Week was the most popular hashtag in the Netherlands. Most of the day. Well, second most popular, I should say, because a hashtag in Dutch, which roughly translates to "let's go outside," was the most popular because of the exceptional beautiful weather. As we just saw in the video, trust is very diverse. Trust of people in health solutions and the use of health data is necessary to achieve all the wonderful transitions we are talking about during the eHealth Week. In the video we just saw, one of the speakers made a remarkable statement. Roughly translated, he said something like, using data is not safe, stop saying it is, and make sure it is as safe as possible. This is both a remarkable and a brave statement for a patient with a mental health disease that is often stigmatized. His message stuck in my mind. Online access to our health data allows us to take more control of our own health. Availability of information on quality of treatment and medical therapists helps us to choose when it comes to our own care. Therefore, accessible health data are crucial for better care. But health data are sensitive data, and precisely because it's about your personal health. And when I look around me, I see so many digital products, devices, services being used in health, and with great satisfaction. A few examples. The app Huisarts, general practitioner, roughly translates in home doctor, is developed by the Dutch General Practitioners Organization. It provides reliable information about your disease and health. People use the app when they, for example, have a stomachache and think something might be wrong. With the app, the user clarifies where the pain is coming from, what the cause might be, and what would be the best course of action. This could be something simple like, wait a few days to see if the pain reduces, but also advising the patient to immediately contact a doctor. Thuisarts now helps 80,000 people a day with health-related questions or complaints. It increases the health literacy of people, helps people to manage complaints themselves, and reduces the pressure on the waiting lines at the offices of general practitioners. This is what I like to call from the waiting room to the living room. Another example. A few weeks ago, I had the honor to visit a nursing home for people with dementia in Bergen-op-Zoom, a small town in the south of the Netherlands. The care provider, named Tante Louise and Louise, uses ICT in most of its work processes. Their system ensures that residents are not locked out of their rooms, and can still go out for a walk, despite their advanced dementia. Thanks to the GPS transmitter embedded in a bracelet every resident wears, the staff always know their whereabouts. If a resident wanders off too far, the staff can alert volunteers living in the neighborhood. A volunteer goes out to meet the person with dementia because they also know where they are, puts him or her at ease, and they might even have a coffee together. A staff member accompanies the resident back to the home again. I call this tailor-made care. I believe that the right use of e-health can contribute more to the well-being of people with dementia than it does today. The final example I want to show you is the use of the so-called black box for operating rooms in hospitals. The Radboud University Medical Center in Nijmegen has been using this for a long time, and yesterday the Amsterdam Medical Center announced they will start using it as well. As in aviation, the black box will track and analyze all surgery information with the intent of learning from mistakes and increasing patient safety. Like airline black boxes, this one is not literally a black box, but consists of linked computers. And the black box stores all information measured by sensors and devices in the operating theater, such as the patient's blood pressure, temperature and pulse rate, but also movements of the surgical staff and the number of times the operating room door opens and closes. The black box analyzes the data and flags abnormalities, which can be discussed with the surgical team afterwards. This to create a better understanding about what is going on in an operating room and to create a learning environment for the surgical team. And I'm proud to say that the inventor of the surgery black box, the surgeon Theodor Ganchadov, is with us today and will be one of the keynotes this afternoon. Although very different in nature, these three examples of tools that increase safety and trust in the use of health data, blah, 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 blah. So, you're all awake now again? Something went wrong here, no problem. They did it on purpose, probably. And so let me say what's standing in. It's not correct. Well, building trust should not be a top-down implemented set of laws that tell people, here's a law, now you're safe. I don't think this will work, or that people will believe it. The most powerful way to achieve trust in e-health is through these good examples and practices, so that people see and experience what works. And of course, governments should implement adequate privacy and security frameworks. However, these frameworks can't replace the effect of a user that is satisfied with a product he or she is using. So, My final call this morning is to work together with governments, health providers, patients, big enterprises, small enterprises and startups to create an e-health environment that people trust. But most of all, e-health tools that people use. I look forward to the discussion with the panel and the great keynotes we have this afternoon from Daan Dome of Focus Cura and Theodor Gancharov. Thank you.
Okay, so Eric is now taking a seat, and he is ready to take your questions, so you can be as brutal as you like. I think he can take it. It's fine. So now I'm very pleased to introduce the Director of Strategy for OSIP Santé. I hope I got that correct, Pascal Sauvage. Good morning.
Yeah. So good morning, Amsterdam. I'm CSO at OSIP Santé, which is the French agency for e-health under the authority of Ministry of Health. I'm in charge of strategy, quality policy, and communication. So those are 3 reasons why I'm here to communicate now about the processes we implement in order to comply with main trends in e-health. As I'm surrounded here by specialists, I will not explain those main trends that are the next slides.
Oh, could we?
Yeah, thank you. So I will not explain those main trends such as analytics everywhere, personalized medicine, cloud computing. What I will try to do is to show the French roadmap that we are drawing to follow those trends. Our conviction, since the agency was created, is that what all those trends have in common is reliable data. So we can...
Yeah, I'm sorry to interrupt.
Okay.
Is there a clicker there? Yeah. Oh, excellent. Good.
Yeah, okay. So to get reliable data, you need data quality and you need data, which seems an obvious statement, but is quite a paradox when you have to deal it with the daily reality of business. So the way we deal with it is building solid foundations. Security by design is the way to infuse reliability in the whole ecosystem. This is our main guiding principle. This is also what is engraved in our law, especially since 2002 regarding health data. In 2002, patient rights law clarifies the rules. It reinforces patient rights, including access to medical records. It enhances the way towards protection of health personal data with certification for health data hosting, patient consent for data sharing, and strong authentication for HCPs accessing health data. In 2004, the law creates National Personal Health Record, and a new agency is created to develop this National Personal Health Record called DMP. But quickly, we face many difficulties, and it appears obvious that a new governance is needed. So in 2009, a new agency is created through a merger of agencies in charge of security, interoperability, and national personal health record. This agency, OSIP Santé, is firmly under the authority of Ministry of Health through the creation in 2011 of a new delegation dedicated to strategy in e-health. So we are now in position to activate all the levers at the same time. Implement regulation to improve e-health, to get data quality and interoperability of systems, act for health digital transformation, to launch new services for sharing and exchanging health data, and develop uses and innovation in order to change practices, which is prerequisite to obtain massive data. So since 2009, we are building a new urbanization. We say urbanization, and it has to be understood as enterprise architecture for the whole health sector. And the booster of it all was the DMP, the National Personal Health Record. To make it work, we had to implement a security framework, an ID for patients, an interoperability framework based on IHE applicable to all health information systems. In 2011, the DMP service was opened. The building block for sharing data was there. And patients can directly access their data in the DMP via internet. Then it appeared a new building block was needed to allow HCPs to exchange data in a secured way. So we designed an environment of trust in accordance with the same frameworks. We call it MS Santé. All operators are welcome to join this environment by contracting with ASIP Santé. For users, using a MS Santé secured email service means having the insurance to exchange data by email in accordance with the law, sharing the same directory of users, and using a service interoperable with other MS Santé services. That's how we get a new enterprise architecture for healthcare systems. Frameworks and infrastructures which constitute an environment of trust. Organized around the patient that can allow to share and exchange data all along the patient care pathway. Now that frameworks and infrastructures are in place, our big challenge is to stimulate adoption of new services. We are working with all stakeholders to develop uses and innovation. In particular, we are working with project owners to make this new urbanization readable so they can rely on it to design their roadmaps for new services. Our aim is to support the whole ecosystem, service providers and end users to understand and get involved in the new value chains of e-health. This is how we can go from data quality to massive data. So we have made security and interoperability frameworks our first priority because we believe that quality is needed for a sustainable development of e-health. We are conscious that these constraints can also be perceived as breaks. So we are working very hard on optimizing processes to ease the adoption of e-health. In particular, we are developing approaches based on certification. We stay in touch with all stakeholders because value-added services are the best way to serve professional and patient interests.
All right, thank you very much, Pascal. So take a seat and remember that you can send your thoughts and questions through on Twitter, but I think we'll also have Kathy, who will be running around with a microphone in her hand, so you can, do it the old-fashioned way and put your hands up as well. So let me now bring in Neil Jordan. He is the General Manager worldwide for Microsoft's health business. Welcome.
Thank you. Good morning, everybody. It's a real pleasure to be here at such an auspicious week, such an amazing audience. I've had a fantastic time back here in Amsterdam, and I will be sad to go home tomorrow to Seattle. In fact, it may confuse people to have a worldwide leader from an American company stand up here with a British accent. So the first thing I'm going to do, because later today, we're going to be talking a little bit about, in fact, later in this talk today, we're going to be asking you to vote. So the first thing I should do is do a little bit of self-identification. Primarily, I am a citizen of the European Union. I'm currently a resident of the United States, and I hold 2 active British passports at the moment. And if anyone wants to know why, I can explain that at some point. So in my life at the moment, as a British passport holder, a a member of the European Union, a citizen of Europe, and as an American resident, you can imagine there is a lot of voting going on in my life. Some really important votes, in fact. I registered to vote against Brexit, just to let you know. I'll be totally open about that for various reasons. Thank you. Not so much for social or political reasons, but more because I believe it actually represents a vote for or against the question of whether we recognize and integrate with others around the world. I think it's a very broad vote, broader than just the UK itself. But the first thing I'm going to ask you to do is vote. As a Microsoft employee, Microsoft that has a relatively new strategy, I need you to vote. I'm multilingual, so you need to vote whether I'm going to do my presentation from an iPad or from my Surface. So could I have by show of hands for the iPad first? Thank you. This is a practice for later. And a show of hands for the Surface. Wow, more for the Surface. Thank you. Okay, I'll do it from the Surface. So later you're going to be doing a little bit more voting, which is going to be voting around the cloud for e-health. This is a really important topic. This is an important topic which is much broader than Microsoft. In fact, today the conversation I'm going to bring to you, I'd say fundamentally is a conversation and a vote for adoption, for innovation, for commoditization, and for interoperability of all health data based on cloud technologies. Why do I say that? Well, in the position that I have at Microsoft, I get the opportunity to look at cloud usage across the world. Let's be really clear. I'm not looking at your data. Never going to be looking at your data, never want to look at your data, but I am interested in how you're using the cloud. And I get to look not just at health customers, but I get to look at other industries as well, and look really in quite a lot of depth about the different services that people use. And I would say that the conversation has changed a lot in the last 2 years around the use of cloud technologies in health. What I see are two things. One, I see the health industry is absolutely lagging other industries today in its use of cloud technologies. No two ways about it. Typically about a third of the usage of even other heavily regulated industries like the financial industry. So there's some work to be done there. But I see, and this is actually much more concerning for me, I see the emergence of a dual velocity of adoption of cloud technologies in health. And in fact, in Europe, I see that polarized even more. So much so, and I was coached not to use the term two-tier in Europe, but I'm going to use it. I see actually the emergence of a two-tier set of technological societies in Europe. Those who are pro-cloud, and those who are either against cloud, which is typically never what they actually say, but are just not sure about it. And this, as a technological approach, is really unsustainable. I'm going to give you a few examples of usage of technology in e-health that simply would not be possible without cloud technologies. The first one comes from Ireland, and I really want to commend the folks at HSE for their cloud-first policy. This is a policy which is going to enable them to innovate faster, that is going to enable them, by stating it, to have a more open and a more commoditized approach in healthcare. And in fact, it's interesting, as a Microsoft employee, as a company that has emerged out of an on-premise technological world into a cloud world, the easy thing for us would actually be to be a naysayer and to say, the cloud is not ready for health. You should all stick with on-premise software. In some ways, that would actually enable us to lock out some competition, which we don't want to do. This is actually a conversation which is much more about opening the market up. So Ireland and HSE are doing that. In Finland, the work that's going on with Health Village, I think, is absolutely groundbreaking in terms of how it's engaging patients. Again, not capable. These are things that would not be possible without cloud computing. In Sweden, the use of advanced machine learning technologies to allow genomic diagnostic of various cancer traits and reduce the diagnostic time from 24 months to about 2 months is incredibly, incredibly valuable. Again, not possible without cloud computing. And then also, if I look at a great example from the UK, where they've been using cloud computing for virtual consults with stroke victims, and literal words out of patients' mouths that without this technology, they would not have the physical mobility that they have now. Again, the ability to do that at scale would not have been possible without cloud technology. And yet, when I look at the European use of cloud technology, I see either ambivalence or confusion. I see very few governments today, very few parties stepping forward and saying, we are going to be cloud first. Cloud first is going to be the approach that we're going to require for anyone who is doing business and creating innovation in this space. And I would say that innovation and adoption, compliance and competitiveness all rely on cloud-first technology. Which is why yesterday we were honored to lead the Cloud Council. It's actually a year since we've had the European Cloud Council, and I think it's actually leading the world in terms of the way that it's working. We had 30 of the top thinkers in e-health around Europe in a room, and we made all a commitment. We all signed a document that committed ourselves to a cloud-first policy. I'd really encourage you to read it. It was announced yesterday, and we'll happily perhaps tweet it out so that people can take a look at it. Again, it is not a conversation about Microsoft. This is a conversation about the industry. We're honored to be leading it, but it is open to anybody to be part of that conversation. And it talks about the need to create, first of all, absolutely cloud-first policies in e-health, and to lead with that from a ministerial point of view. Secondly, the need to clarify regulations. Often, to be cloud first, you don't have to change regulations, but you do have to provide a lot more clarity around what is and is not possible. Once that clarity is provided, it's amazing how fast the industry can and does move and starts to innovate further. And then finally, the need to simplify the actual underlying certification procedures to be certified for using the cloud. These are today a real hodgepodge, an alphabet soup, we call them at Microsoft, of different requirements. And actually, if you look at the requirements that are out there with EU model clauses, with ISO, many different ISO certifications and attestations, they more than cover the requirements for trust, for compliance, and for privacy in the cloud today. And in fact, I'll finish off by saying one of the most fascinating things at looking at the data of usage of cloud is that the usage has changed and the conversation has changed. I would have said that even just a year ago, 80% of the conversations that I was having with customers, with government officials, with vendors in the industry, basically went along the lines of, it's not possible to do the cloud in health. It's too hard, it's too complex, protected health information, regulation. Now when I look at the usage, the realization is that the cloud is not a threat to privacy, security, and trust, but actually is the only way of creating privacy and security and trust. When I look at the data today, yes, the health industry is still lagging other industries in its use of the cloud, but its usage, at least on the data that I see, of security, identity management, access management technologies is actually 6 to 7 times the usage of those technologies in other industries. So people are actually leapfrogging and using these technologies to make sure that there is trust and there is privacy. So now it is time for you all to vote. You have a simple vote. Your vote is either to be cloud first or to not be cloud first. That is the simple vote. So I'd like, first of all, by show of hands, those who are not cloud first in their thinking for e-health. And we respect that point of view. Thank you, sir. And those who are. Great. Let's get on with it. Thank you.
Okay, thanks very much, Neil, Pascal, and Eric. Actually, given that everyone's just done a vote and put their hands up, I'm wondering if there might be any questions, probably to Neil, on cloud usage, if anyone has any questions. And I don't want to pick on the gentleman over there who actually disagrees with it. But would you mind if I did? What?
And the reality
because I'm a nosy bugger and I do that.
Well, also the reality is the point of view is very
but
important.
let's not pick on him too much.
No, but the point of view is very important, right? We have to be listening.
I think he is willing.
We're just going to get a microphone to you. Yeah.
I think it is about the functionality you have to choose and not about techniques.
The
and cloud is a
you have to
technician.
choose.
So saying cloud first,
Yes.
you're going for a technical solution. And I'm not interested in a technical solution.
Interesting. So, I'm very glad you brought that up. And you notice we use the word, or I use the word cloud first, not cloud only. We don't believe in any sense that the decision to use cloud computing is a black and white one, where you say, I'm either going to put everything in the cloud or I'm going to put nothing in the cloud. In fact, increasingly the technology supports the ability to have both the level of functionality that you want and the level of cloudability, if that's a real word, that is needed across it. So it's an excellent point that you bring up, and there shouldn't be. And I'd say probably initially there was, but as technologists, not just Microsoft, but other great cloud providers as well, are getting better at the technology, it's not a compromise between those two things. In fact, interestingly, and it's complex for us in some ways, some of the newer functionality that's being delivered gets delivered first in the cloud and then on-premise, and sometimes that can frustrate the customers who have not made that change. So it's a very valid viewpoint.
There's a gentleman here, but we'll get a mic to you in a second, but there is the gentleman there who has the microphone, yeah.
So thank you for the presentation. I would agree to the other person here. I think it's not about putting cloud first in all places. It's about weighing between benefits and costs for every application that you have. So, for example, I'm teaching at university. I usually ask my students, show them like this shirt with all sensors built in, and would you like to wear that shirt and your data will go to the cloud? Nobody, or almost only a few people will say yes. And then I say, okay, now you're in a situation, you're fragile, old, and in order to still live at home, you need to be monitored because you're alone. And would you then do this? And then many of them say, yes, we would. It's always weighing between what do I get from it and what is the cost of it. There's always a risk of a security breach. We all know that. There's nothing safe, but it's what do I get for it?
Yeah, and it's interesting. I don't mean to answer all the questions, but it is interesting that when you look at that question of security breaches and you compare the number of security breaches that are down to on-premise software versus in the cloud software, and I would encourage people to go and look up some of the data from the US Department of Health and Human Services. They're kind of the fullest amount of data around this. You actually see that 96% of the breaches that happen are actually on-premise. So it's a real concern that is absolutely real, and I think we all, as leaders in health, have to be open to the discussion and have to be very transparent about the numbers as well.
The gentleman
Hello,
here.
hi, how are you? My question to Pascal. So now, these days, we witness new types of attacks, especially the ransom attacks. So what do you think the impact of these kinds of attacks on the architecture of the health information exchange? Especially now, we put everything in one place. So do you think that we need to adjust these kinds of architectures?
So your question is, do we have to all adapt our architectures?
Yes,
to
because
get
of these ransom attacks that are happening these days, that they can just capture all the data because they are in one place. So do we need to do any changes in our architectures of HIEs, Health Information Exchange?
It depends on what you're starting for, but yes, we are building frameworks. But what I would like to point here is that all frameworks, all constraints that we are building them in co-construction with vendors. So we try to make sure that what we are building is feasible, so that we make sure that data are really protected. So we are trying to build frameworks with a high level of constraints, but we build these constraints with all stakeholders, so that we make sure everybody goes to the aim. You understand?
Maybe let me chip in here, because there's a lot of talk about the importance of architecture and ICT. But I think we can make a huge step in tackling these problems when we take the vision, when we change our paradigm and making patients owner of their own health data. I think that might be even a bigger step for tackling things like trust or privacy. And of course, the technical solutions are also important, and it's all, as we know, it's all about behavior as well. But if you make that even more fundamental step in developing technology that makes this philosophy possible, then you are more than halfway there, I think.
And it's interesting. I totally agree with the viewpoint. you can put the technology in place, and you can have great frameworks like the NIST framework, extremely helpful to understand kind of risk and reward in this space, and particularly with these discussions of ransomware attacks, you know, where I think the US has probably had more of them than anywhere else. What's fascinating about them is how many of them were willful giving of information by employees. So you can have the best technology in the world, and in fact the technology is getting better using things like advanced threat protection to understand where the real vectors of attack are going to be. But at the end of the day, if you don't have trusted employees who also, you know, in a couple of cases literally gave usernames and passwords to the cyber terrorists in this space, then it's hard. So trust has to be much more broad than just a technological approach.
Any more questions coming in? Put your hand up. Actually got a question on Twitter, Eric, about which camp the Dutch government might fall into. How do you feel about cloud usage?
Well, again, I think we're in favor of it because, of course, it starts with the functionality question, but I also think that the functionality we want to improve healthcare, to make e-health possible and all the good things we can do, many of these things, they need the cloud solution. So I think it's not a question of are you for or against it. It's in that way it's inevitable that we should go there and ask the tech guys to make it technically as safe as possible. But again, I'm a big fan of this philosophy of, you know, it can, all those different data, they are everywhere in clouds or maybe in registrations of hospitals or general practitioners, but let's develop the technique that makes it possible for me to get it from all those different basic systems. And that I am the one who's in the driver's seat of this data, and I can decide who to share these data with. And after I use them, they will be gone again till the next time I will use it. And I think that's probably the biggest contribution to building trust and protecting privacy. But of course, I think we need cloud solutions to make it happen.
And the video that we had a little bit earlier, Trust and Standards, had some interesting views expressed with, you know, obviously concerns about data sharing, but at the same time we heard one gentleman saying, well, we don't understand why there is such a worry about this when we willingly share so much on social media and Facebook. Where are we going wrong, Neil, in terms of building trust in these systems?
I don't know that we're going wrong, I just don't think we're going fast enough, and I don't think we're explaining in I use this word positively, in simple enough terms, what is possible and how data is being looked after and how data is being protected. You know, as Microsoft and as many other cloud vendors do the same thing, we're extremely clear. We have a thing called the Trust Center, where you can see exactly what Microsoft does do in terms of protecting data that's sitting in Microsoft's cloud, and exactly what it doesn't do, including not giving data to governments when they ask for it, for example. And I think the more clear we can get and the more simple we can make the language around that, the faster we can build trust. I think the other thing that has to happen is, particularly in the health world, if you look at the e-health history, really, over the last 15 years, the predominance of technological discussions were around building systems of record, electronic medical records, RIS-PACS systems, and so forth. Systems of record was really the conversation at every single HIMSS discussion, you know, that I'd been to. That's changed, and in a good way. And the conversation really now is about systems of insight and systems of engagement. Now, the systems of record are important, but ultimately the transformation that has to happen of engaging with patients more, empowering clinical teams, creating optimization of clinical effectiveness and transforming the whole care continuum is only going to happen with the systems of record and the systems of insight. Excuse me, systems of engagement and systems of insight. And those two, the functionality, back to the gentleman's question, those are very, very hard to deliver without cloud technologies. So again, when you show people what they can do and the capabilities of the technologies, and at the same time you use extremely simple language to explain what is and isn't happening with the data, I think you can move quickly.
And Pascal, what are your thoughts on that,
My
on building
think is,
trust and reassuring people?
At the beginning, the point was only to watch that data are hosted. Now the point is to watch how data are used. So this is new way of watching that we have to find. So we are just at the beginning of implementing new way of watching. So that's where we are now, I think.
And can I ask your thoughts, Eric? I think I know what your response is going to be, but let me ask it anyway. When it comes to how data is used, you've definitely come up against some obstacles. Here in the Netherlands, legislation which has been voted down, which has kind of slowed down the implementation and the sort of broader usage of e-health, progress that could have been made. You've lost a little bit of time. How are you overcoming these obstacles? What are your plans now going forward?
Well, now, of course, this is tricky ground for me because we're going into the political field and everything I say, my minister is responsible and it's recorded as well. So let me take a second. Well, first of all, I think I don't like the word obstacles. So I'm always talking about entertaining obstacles. I've learned this word from the CEO of Bernhoven Hospital, who says there are no obstacles, there are only entertaining obstacles. So that's one. And I don't really, although we run into some difficulties with legislation, I don't really think in the end legislation is holding us back. Because what we are talking about, it's all, you have legislation and you have the real world. And in the real world, you can do a lot of things, no matter how the legislation is specifically designed. Because if your story is right, if your intentions are good, if your goals are clear, then you pretty much you can realize your goals no matter how the legislation is specifically worded or designed. At least that's what I think.
And Pascal, what are your thoughts on this? You spoke a lot about security and the way we use data and what expectations are. How much are things being impeded on the local level and the national level by what's happening regionally, EU regulation? How much of a problem is this?
The problem is to make understand the architecture we can implement at a national level and how architecture that can be implemented at local level can be organized in relevant way towards the national infrastructure. I don't know if I'm clear. So we have to make understand new themes, new architecture, so that at the local level they can also design new architecture relevant between what we are building at the national level. So that's how we can have an organized way of administrating data.
Maybe if I may, let me add something with respect to this legislation thing. I mean, we always talked about it's not possible because of the privacy legislation. And people then tend to forget that there's one simple solution to always be in compliance with any privacy legislation anywhere in the world. Just ask the patient what he thinks. This is a patient-included event. Just ask the patient, and if he or she is okay with it, then you're on the right track.
Neil, what do you think about that?
I absolutely think the patient owns the data. I wish it was true globally that if you just said, hey, patient, you own the data, you'd be able to skirt around every privacy law. Unfortunately, that's not the case globally. In many countries, that is the case. But again, I think the question is not just about privacy, it's around trust and around securing the data in a good way. So agree, patient needs to own the data, but I also think in some cases legislation has to change. Typically, it's not the case that it does need to change, but it does need to be clarified.
Neil, you were saying to us that you're living in the States. You've been living in Seattle for nearly 11 years.
Yes.
And you're a British citizen. You have to. You're European. You're a citizen of the world, but you're a European citizen, and you've got. All this voting going on that you're keen to take part in. But then let me ask you about, do you ever see the time will come, where you would be able to travel around Europe, you would be in the UK, in the US, and there would be some kind of free-flowing exchange of data that kind of feeds into this seamless, continuous care that we're always talking about? Would that kind of infrastructure ever be in place?
I mean, the infrastructure is in place already. At a patient level, the infrastructure is in place already. Getting that data into hospital systems and out of hospital systems is not in place. But as a patient, can I travel around the world and have a record, a digital record that follows me around? Absolutely, that's possible right now. I think the more difficult questions are how do you get that information in and out of hospital systems? How do you make that information valuable to the patient themselves? It's interesting. I mean, we launched a digital patient health record called Health Vault about 9 years ago. We still have it. It's still in use. It's still active. But what we've realized is that actually just access to the data is probably not even the first step in transforming the system and digitizing the system. Most patients, most citizens, most individuals are not particularly interested in that, but they are more interested in the insights they can get out of the information, and also the way that having a digital interaction with the professional health system allows them to do it in a more convenient way. So this idea of a PHR, a personal health record, is kind of slowly shifting towards a PHI, a personal health interaction, and I realize that term means other things as well. And we need to accelerate that as well. So just taking the data is just step one.
It's just step one. And so before we break off into our sessions where we're going to really delve deeper into the specific issues within trust and standards, let's conclude maybe this little discussion by getting a thought from each of you on the single biggest problem, or the one biggest thing, something actionable that can be done to build and improve trust and standards. Eric.
Well, I think I just want to emphasize the importance of, trust is not a thing you say, okay, let's trust each other, and then everything is okay. You have to build trust step by engaging patients and clients, and then we will get there.
Pascal?
So we were speaking of trust and standards, but it really quickly comes to interoperability. That's what we just said. Interoperability and adoption.
Neil?
More clarity, more precision on precisely what can and cannot be allowed in the cloud in each country. That's the only way we can move forward once there's more clarity.
All right, guys, thank you so much. That was really interesting, Eric, Pascal, and Neil. It's time now for you to break away and do your thing. There's lots going on the agenda. But that wraps up the morning's plenary. I think we're going to regroup back here in a couple of hours at about 3 o'clock. So I'll see you. We've got lots going on. And of course, don't forget, you can download the Ehealth app. That'll give you all the information about speakers, sessions. And of course, you can exchange information and ideas on there as well, because we can't be everywhere at once. So that can be downloaded at ehealth.org. So I think you can grab some coffee now, and I'll see you a bit later on.